This is of importance to everybody who wants to hang on to their teeth. By the time you're 65, studies show that 97% of seniors have periodontal disease. Most mouths are on a downhill escalator. They never get better, they always get worse. And it is stoppable, it is reversible. When your gum pockets go away, you know how to keep gum disease away. It's pretty much a crisis and you need to get on it. Most people know that cavities are caused by bacteria getting inside a tooth and forming this cavity. What they don't understand is that there are other kinds of bacteria, and actually quite a conglomeration of bacteria, that can form a space or a cavity down the side of your tooth between the root and the bone, and that is called a periodontal pocket. Hi, I'm Ellie Phillips, and in this video I'm going to explain how a periodontal pocket forms, what you can do about it, the products that I recommend you get using straight away, how they work. And if you want more information at the end of this video, I have a website, drellie.com, where you can find links to the products, more information about how to use them, and there's an oral health video boot camp that many people have found really helpful to get rid of this problem. In this video, I want to talk about pocketing, periodontal gum pocketing, and it happens to a lot of people. By the time you're 65, studies show that 97% of seniors have periodontal disease or they have already lost their teeth, likely because of periodontal disease. So this is of importance to everybody who wants to hang on to their teeth. And it is stoppable, it is reversible. Contrary to what you will find if you go Google searching, that you have no control and the only people who can help you are your dentists. And the problem with dentistry is it is a mechanical cleaning that they're going to offer you. And I want to explain why a mechanical cleaning is not the answer. That's why they cannot stop periodontal disease or periodontal pocketing with a deep cleaning. And sometimes you can spend thousands of dollars, and I know people who are desperate because they're being told they need thousands of dollars of work done at the dental office, and I want to explain how you should help yourself and why you should use the products and the system that I recommend, which if you go to my website at drellie.com, you can download a booklet, you can see the products, how to get them. These are over-the-counter products, they are not my products. And when you put these products together, you can do so much for yourself before you go to that dental appointment. So much so that many people, when they finally went up to their dental appointment, didn't need the deep cleaning. One lady got her $5,000 handed back to her. And I'm delighted if you can save that money and do something different with it. So this is a tooth. And this would be a normal attachment of how the tooth is attached to the gum and then to the bone in which it is. And the gum line should be about the level of where your tooth meets the root of your tooth. And keeping it there, there is elastic virtually in the gum here that holds it tight against the neck of your tooth. Now, problems begin when plaque, which are floating in your saliva, in the liquids of your mouth, end up sticking to the side of your teeth. And when the plaque is here on the side of your tooth, it causes inflammation. And it causes this gum to basically be on fire. And unfortunately, this inflammation breaks down the elastic that would normally hold the tooth tight against the gum. The gum gets floppy, squishy. And unfortunately, sometimes that opens up a great big space because all this gum tissue has gone away. It's got so floppy, it's allowed a big space to occur between the root of the tooth and the gum. And the problem is that there are bacteria, not just plaque bacteria, because they like to stick on teeth, but there are bacteria that love to go into this pocket. The reason they like to go in there is they are called opportunistic bacteria, and they are all kinds. There are little squiggly ones called spirochetes. There are P. gingivalis, which is a different shape. There are all kinds of columnar ones. There are about 11 different kinds of these opportunistic bacteria that want a dark, low oxygen space in which they can multiply. They cannot multiply when they're out here in the public, in the middle of your mouth. They require this little space that opened up when you didn't brush your gums one day, and your gums got infected and irritated, and they began to bleed. And unless you worked really hard straight away to stop that from progressing, and you have to do it immediately, 24, 48 hours after you see your gums bleeding, you have to go back in there and keep brushing them and keep them clean and use xylitol and use my system. And then that would clear up and this would not happen. That is preventive. But let's assume you have pocketing. Well, your dentist is going to measure the depth of this pocket for you. And he or she will do that by inserting a probe, a metal stick, down where this has all disappeared and opened up, and will give you a measurement. In a healthy mouth, I would expect to have 0 or 1 as the measurement, 0 or 1 millimeters of pocketing. In other words, nothing. The minute you get 2 to 4 millimeters of pocketing, you have a space, a potential space. I'm not happy with leaving 3 or 4 millimeters of pocketing. And the problem is that these bacteria actually break down the little hairs that normally connect the gum, the bone, to the tooth. These little fibers are called periodontal ligament fibers. They're very, very tiny. They are 1/100th the width of the hair on your head. And unfortunately, the poisons made by these bacteria in the pocket dissolve those fibers, which allows more pocketing to open up deeper and deeper and deeper. That's how you get these awful measurements of 6, 7 millimeters. And once you're at 7 millimeters, 8 millimeters, your tooth probably has no support. Because along with this loss of attachment, when there is no attachment between the tooth and the bone thinks it's a waste of time, so it begins to disappear. And the bone is the thing that's holding your tooth into your jawbone. So what to do? It's pretty much a crisis, and you need to get on it. And you need to start with all the products in my complete mouth care system. And the xylitol is central. You use xylitol at the end of every meal, and then you don't eat or drink. You rest your mouth for an hour afterwards, so that the xylitol can feed the good bacteria, because there are lots of good bacteria that actually zap out the ones you don't want. So having a really good population of healthy bacteria in your mouth is part of the preventive process. Dentists will say xylitol doesn't help with gum disease. Well, it does, because it helps up here in the saliva of the mouth. Xylitol doesn't affect plaque bacteria in saliva, but it does get rid of some of the opportunistic bacteria that would be forming problems in the pockets. So xylitol works 2 ways. It feeds the good bacteria, but it also loosens up the bad guys. It loosens up the plaque bacteria. It stops them from multiplying on the sides of your teeth, and it makes this stuff looser so that if you are brushing well, it'll brush away. So xylitol is very important and foundational for feeding good bacteria, getting the plaque to get off your teeth so that you give your gums a chance to reattach and to get back tight in contact with your tooth, because that's our goal. Now, how do you get rid of these periodontal opportunistic bacteria that are in this messy old pocket? That would be the first mouth rinse that I recommend in my system. Closis is an incredible surfactant. What does that mean? It means that it goes down even little thin spaces between the tooth and the gum. I used to use it to clean the cuticles when I was gardening, and I would get dirt under the cuticles of my fingers and I couldn't get it out. I would put a little Closis and it would go under the cuticles, loosen the dirt, and then I could get a scrubbing brush and clean up my fingernails after I had been gardening. And it's kind of the same principle here. You let the Closis go down and loosen things up, basically. It reacts with saliva to form oxygen. Then you don't get a scrubbing brush, you get a really well-designed toothbrush, one of the ones that I recommend, a flossing style toothbrush, and you would do gum massage on the outside areas of these teeth where you have pockets. Now, this gum massage is doing a variety of different things. The gum massage, when you massage your gums, is going to help extrude some of these bacteria that you don't want. It's just the way it is. You'll be on the gums, it'll get circulation there, it'll bring new blood vessels to grow into this area. And when new blood vessels grow into this area, if you're doing this gum massage in the way I recommend, it should stimulate stem cells, which are in the blood vessels, in the tissue. So you have blood vessels bringing blood to your gums, and when you are doing massage, these blood vessels start to grow little capillaries into the area where you need the healing. And along these capillaries come stem cells, undifferentiated cells in your body that will be anything you need them to be. And when they reach this area and see, goodness, we've got to grow ourselves into gum tissue, that's what they do. It's a wound healing mechanism, just like the wound healing that occurs when you graze your knee. Okay, you graze your knee, you cut your knee quite badly. You don't have to do anything. Your body knows what's going on. It calls for new blood vessels to grow in. That's when it's all pink and bleedy. Then those stem cells arrive and they start turning into skin tissue and all the things you need for your wound of your knee to heal. And at the same time, there are lymphatic tissue liquids, which you may or may never have heard of. And this is a liquid in your body called lymph. And if you're massaging these gums, the lymph will take away the poisons. It will actually return it back to be eliminated from your body. So there's a lot of activity has to occur in the tissue around a pocket for it to heal up. And you can use the products that I recommend usually for 3 to 6 months. And you can actually measure, if you do my system, what does this look like? If we took a sample of your saliva, is it looking like these bad bacteria going away? Are they reducing in numbers? We can test that. You can do a salivary test and see that after 3 to 6 months, you will have lower levels of these bacteria that are problematic in the gum pockets. That's one way to test. You can also go back to your dentist and have them check with that spiky thing, have your pockets reduced. And a dentist will be shocked. They're not used to seeing pockets go away. And if you read some of these testimonials, you see that 6 and 7 millimeter pockets became 5. That's a cause for celebration. You are going in the right direction. If you've heard some of my other videos, I talk about being on an escalator. Most mouths are on a downhill escalator. They never get better, they always get worse. And the best your dentist can do is kind of hang you out there in the middle. If you get going and do this system with a really powerful, all the things I recommend, you will turn yourself around and start getting these pockets to go away. It is exciting, it is possible. The first patient who ever did this using my system was my mother. She was 45 years old and told that all her teeth needed to be extracted. These pockets were so deep, her bone was so lost, she had no support. I have another story that you can find on TikTok and on YouTube of a Down syndrome patient of mine who was 21 years old, and her front teeth had pushed out because with Downs, the syndrome of Downs, they have bigger tongues that tend to push loose teeth forward. So these teeth are always being pressured to move forward. And the bone had disappeared in the front, and the teeth were tipping, and there was no more attachment. But the mother didn't want to have the teeth taken out, and she found me. And that was 11 years ago. And I simply put them on my system of care with the gum massage, the right toothbrushes. This child is now in her mid-30s, has not had those teeth extracted. And that's an exciting, remarkable event to celebrate. When your gum pockets go away, you know how to keep gum disease away. If you start before you have gum disease, you'll never get gum disease. The sooner you start, the easier it is. If you've got 7 and 8 millimeter pockets like my mom, it's hard work. And it also depends, as you get older, on your body healing mechanism. Are you eating for your blood vessels to grow? Are you eating for your immune system to be able to cope with all this debris and take it away? Are you sleeping? Are you exercising so the circulation is working for you? It isn't just brush your teeth. It is your whole body health is coming to help you get rid of this very aggressive, very dangerous condition of gum pocketing.